In this video, we're going to talk about how to differentiate the various causes of hip pain. We get questions all the time about this. We get people reaching out asking us if we can help them with their hip pain. But the first step for you or for us as a practitioner is to understand where is it coming from exactly so we can actually treat it properly. My name is Dr. Todd Pickman. I'm the clinic director of Gonstead Spine and Wellness here in Meridian, Idaho. Let's dive into it. Postural distortions. This is another thing. We look at a full spine view, and on the side view, the head, the rib cage, and the pelvis should all line up. So if we draw a vertical line like that red line, we can see in this diagram, this person's 114.9 millimeters forward. This is abnormal sagittal balance. When you're off like this, it changes stresses lower in the spine, messes up the lower back, puts stress on the pelvis and the hips, and this can cause hip pain. This patient actually was in their 70s when we took them through care, and this is a pre and post x-ray. So this is about 3 months later. So we were able to reduce that abnormal sagittal balance from 115 down to 50 millimeters, pretty massive. Another 3 months later, took it down to 33, 34 millimeters. So this is showing that at all ages, there is room for improvement. And this was life-changing for this patient who had a bunch of symptoms in their low back and hips, and that improved by starting to fix these issues. Okay, so these are just some other examples of abnormal sagittal posture. Some of these x-rays, like the previous one, was a patient in their 70s. This is someone in their 30s. Okay, this one here is someone in their early 50s. And then this one over here is someone in their 60s. So it can happen all ages, but these are all abnormal postures. You should have that nice green curve in the spine, and when the body shifts backwards, that means something. When you lose the curves altogether, like in the middle picture, that means something else. All of these things will affect overall mechanics of the spine and can lead to low back and hip pain. All right, thoracic translations. This is now looking at someone as if we're standing behind them and we're looking to see, is their rib cage shifted one way or the other? And this can be driven by a short leg, or sometimes the leg length is totally normal, and this is driven by things above there in their lumbar spine, as far as from traumas, where a bone shifts, it gets stuck, and then they basically have to hold themselves in this compensated position to try to avoid pain. It's called an antalgic posture, and then it stays there for several months or years, and then the tissues conform to that abnormal posture, and now they're stuck in that position. And then years later, they come in, they see us, they say, hey, I have hip pain. We take a full spine x-ray, we do an exam, we say, you're shifted way off to the side, like an inch off center. That's a big deal. There are ways that we fix this. We do it with spinal adjusting, postural corrective exercises, and sometimes even traction, pulling them back into a corrected position to remodel those deep deformed tissues around the spine to try to get someone back into a more neutral position. All right, so this is just showing a variety of different x-rays shifting back and forth. These are all different patients, different configurations. Another postural distortion is pelvic rotation. So this on the left here is a bird's eye view looking down at a patient's glutes. So looking at the butt, looking straight down, looking at the heels. Now you can go to your spouse, your friend, or your neighbor, or whomever would allow you to look at their pelvis down at their heels. And you can see, if you look bird's eye view, what should happen is the heels and the pelvis should be aligned. On this picture in the middle here, we can show that the pelvis is rotated backwards compared to the feet. That is a right posterior rotated pelvis. That's a problem happening in the actual femoroacetabular joint, in the hip joint. There's asymmetry in the muscle. There's loads on those ligaments and tendons in an asymmetrical fashion. Lots of asymmetry in the muscles that can definitely cause hip pain. So a pelvic rotation postural distortion can cause hip pain. This is something that we look for. We have specific exercises where we actually mirror image this process. So we have the patient move in a opposite movement against resistance. And so combining with adjusting the joints need to be adjusted, doing exercises, and in some cases, there's other types of traction, not specifically for this, but there's oftentimes other postural problems that accompany this. Okay, so there you have it. That is a breakdown of the different causes of hip pain. We covered almost everything out there. There's probably a couple others that I didn't cover, but if you have any sort of hip pain, or you know anyone that has hip pain, or if anything that you watched in these slides intrigues you as far as just wanting to get a full comprehensive spine workup, you can reach out to us. Our clinic's Gonstead Spine and Wellness. Our contact information will be below. And when it comes to the health of you and your family, results matter most. Thank you for watching. Make sure you subscribe, like, and comment. We appreciate you watching, and we'll see you on the next video. Video presentation by Meridian Gonstead Spine and Wellness of Meridian, Idaho. Our practice is dedicated to people suffering from neck pain, low back pain, tension headaches, migraine headaches, herniated discs, and leg pain such as sciatic. We have treatment protocols for musculoskeletal aches and pains, joint pain and dysfunction, and whiplash injury. Gonstead Spine Wellness offers a distinctive chiropractic experience. It is the only office in Idaho with digital motion X-ray technology. And this advanced imaging tool, combined with the Gonstead spinal analysis and necessary radiographs, enables precise identification of spinal issues. We provide safe and effective Gonstead adjustments, corrective care through chiropractic biophysics to enhance and sustain proper posture, and a 12-week transformation program. This program includes access to a comprehensive video exercise library for ongoing home support, ensuring long-term health and wellness. Call us at 208-888-6077, where results matter most.